Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and today's topic is all about lung cancer and the essentials of prevention and screening. Joining me today to talk about this is Dr. Jerry San Pedro with Willis Knighton, Red River Pulmonary and Critical Care Medicine. Thanks for joining us.
Well, again, thank you for having me.
Absolutely. So tell us a little bit about what you do as, I'm assuming, a pulmonologist with Willis Knighton?
That's correct. So a pulmonologist is a specialist in lung disease. So we take care of people with asthma, COPD, chronic obstructive pulmonary disease, and unfortunately smokers with nodules, and we'll talk more about nodules here shortly, and people unfortunately with lung cancer, which is our topic for today.
Absolutely. Yeah, November is Lung Cancer Awareness Month, and it's just a month dedicated to talk about the screening risk or screenings and then maybe the risk factors. And so it's really important not only this month but all months, especially if you've had that history of smoking. And you mentioned another important day coming up tomorrow. It
is. So the American Lung Association, American Cancer Society all got together, and we all recognize how important smoking is in the risk of lung cancer. So we've specifically put the third Thursday of the month off to the side and designated as the Great American Smokeout, which is specifically dedicated to trying to get people to stop smoking.
Yeah, it's not going to a barbecue and smoking some sausage or meat or anything like that. It's talking about smoking. Okay.
Truly about cigarette smoking, specifically. Yes.
Okay, yeah, and so that's, as you mentioned, a really big factor maybe in increasing your risk for lung cancer, would you say?
Correct. Yeah. So I think all of us have been touched by lung cancer. Lung cancer is very common in the population. In the United States alone, about 600,000 people have either been diagnosed with cancer, living with cancer. So it is a very common process amongst all of us. And unfortunately, smoking is the #1 risk for lung cancer. Smokers have 11 times the risk of cancer than non-smokers do. So 8 to 9 cases out of 10. So 80 to 90% of all lung cancers are associated with smoking. Now, that truly means about 10% of cancers do happen in non-smokers, but that's a relative minority. So unfortunately, smoking is still the #1 risk factor for lung cancers, all lung cancers.
Right.
So it's important for doctors, for current smokers, to try to mitigate, to decrease the risk. And the #1 way to do that, of course, is to stop smoking.
Right, yeah. And so you mentioned the impact that it has, nationally, but what is particularly concerning, in your opinion, for Louisianans?
Unfortunately, Louisiana still has a higher incidence of smoking than nationally. Nationally, the United States, 16% of adults smoke. In Louisiana, that's more like anywhere from 18 to 20% of the population still smokes. So pretty much higher, and that's reflected in our number of lung cancer cases. Louisiana still has almost double the number of lung cancer cases nationally as the United States. So it's a reflection not only of our population, the likelihood of smoking, but also occupational exposures. We all know, especially down south, how we have lots of, unfortunately, chemical plants. The oil and gas industry is very big in our state, and unfortunately they get exposed to all sorts of potential carcinogens, things that increase their risk of cancer. So it's not just smoking, but smoking is still doubles, triples the risk, the combination increases the risk of cancer.
Absolutely. Yeah. And so with smoking and maybe Louisiana having that higher incidence of smoking,
Yes.
it also increases others their risk for secondhand smoke and being exposed to that.
That's correct. That's correct. So, yes, that's one thing I neglected to mention. But yes, secondhand smoke is very important to increase the risk of cancer. So even non-smokers, personally, you may not smoke, but you're exposed to the risk. So household members, for instance, of a smoker who smokes within the house have 4 times the risk of lung cancer. Now, the person who smokes has 11 times the risk, but secondhand smoke has 4 times the risk of cancer.
Wow. Yeah. That's still pretty high
Pretty
risk.
substantial, yes.
Yeah. Okay. And so we are going to be talking about, treatment maybe and screening as well. But so how does those environmental factors play? We live in a state where there are those exposures that you're going to have maybe if you work, like you said, in the oil and gas industry. So what are those environmental things that we want to look out for?
So yes, in our state, we don't have the very high risk of radon gas exposure as some of the northeastern states would have. So that's a minor, almost negligible number. It still happens, but it's very small. Smoking is still the number one risk. Smoke exposure, occupational exposures. We mentioned fumes, etc. But we shouldn't forget other factors such as X-ray exposure, radiation exposures, and unfortunately age. Many lung cancer, most lung cancers are diagnosed in people over the age of 65. So as we get older, again, it's the accumulation of all the exposures we've had throughout our lives. So yes, as we get older, the risk of cancer goes up.
Right, and that's something that you really can't prevent, right?
Yes, unfortunately so.
Okay, right. So if you're just joining us and you have a question for Dr. Jerry San Pedro, we're talking about lung cancer, maybe screening, the risk factors. We went over a lot of those just now. But if you had a specific question for our doctor, then give us a call at 318-219-4569. And Healthline is where we get to talk about these things that are going on in the health world and things that are concerning. And we definitely want to get to your questions if you have any specific questions. Maybe you have lung cancer, or if you have a family member that has lung cancer. And then maybe, of course, prevention is a big thing.
Absolutely.
Which we can maybe go ahead and start talking about too. So screening and early detection, and maybe it's not so much prevention, but finding it early is the most important thing. I mean, prevention, yes,
Correct.
Decreasing smoking, but how do we best find lung cancer early enough?
So one of the problems with lung cancer has been that it's been a silent killer, if you will. It's not until pretty late that people have symptoms, coughing up blood, that weight loss, that tiredness, etc. So in the past, it's been true that lung cancer has been advanced, or it's a very large mass by the time we find it on a plain X-ray. And so doctors have always been very dissatisfied with just using a chest X-ray as the only screening method to find cancers. Because cancers, again, in the lung, they have to be a certain size to be visible on a plain X-ray. So we've stopped relying on just the X-rays. A CAT scan, a CT scan, shows us a lot more detail than a plain chest X-ray would. The problem with the CTs is just the radiation exposure.
Yeah.
A conventional CT is, one conventional CT study is about 70 times the radiation exposure as a plain chest X-ray would. So again, it was a trade-off between how much radiation and the dissatisfaction with just plain X-rays. Well, nowadays, we can do low-dose CTs, LDCTs, which decreases the radiation exposure 15 times the conventional CT. We still see the detail. We can still see a lot of things on a low-dose CT that we can't see on a plain chest X-ray. It's quick, it's easy. So now that's the method of choice to find lung cancers. So if you've smoked a pack a day of cigarettes or more, 20 years or greater, so age 60 and above, actually 50, 50 and above, then we highly recommend that you have an annual chest CT, low-dose CT, to screen for lung cancers.
Gotcha.
So unfortunately, I'm in that group too. As we all get older, now we have to worry about colonoscopies and blood pressure checks, et cetera. But add that low-dose CT to that list of screening tests that we all should consider, especially if we've had substantial smoking.
Okay. Can you also elect to have that screening even if you haven't smoked before and you're of that age?
You can have a screening CT. Of course, again, your likelihood of cancer is very low if you're a non-smoker. But yes, if you've been exposed, we've had secondhand exposure, have had exposure to fumes, radiation as part of your job, yes, we do go ahead and screen with low-dose CTs.
Okay, good to know. Well, we have our first caller.
Oh.
Melissa, thanks for joining us, and what's your question?
Yes. Hi, doctor. I have a question.
Yes, ma'am.
Go ahead.
Okay, I'm always winded. Okay, I've always been short of breath. I know you said it starts in your 50s, but I've had it for a long, long time, all my life. I've been short of breath. I have had a father that had smoked for 30 years. And I have been winded for the last year where I could read a line, a sentence for 8 words, and I'll be out of breath. I can talk for a bit, and I'll be short of breath. And so it's getting worse, the short of breath of walking a distance and all. And but now I'm getting winded just talking for a little bit. I have to stop to catch my breath. I don't know if these are signs or symptoms of me going to be getting lung cancer. I've been to lung doctors.
Yes.
They once told me I had COPD. Then I went and did a 6-minute walk test, and I went back. I said, I want to do it again. I put a fan by my face, and I passed it. And she says, I don't know how you passed it now, so I guess you don't have COPD. And then my heart doctor says it's a lung problem. Then the lung doctor says it's your heart problem, because I also have a heart problem. So I'm trying to determine how will I know if my TV keeps going in and out, so I didn't hear what you said for the symptoms to be causing what indicates it, but I didn't know if me being winded is that causing me to be getting worse and that I'm going to wind up having lung cancer.
So thank you very much for that call. So shortness of breath, as everybody's already told you, has multiple causes, not just lung cancer. But yes, shortness of breath can be a sign of lung cancer. However, it sounds like you've already had a fairly extensive evaluation, both by the heart doctors and a lung doctor. And maybe it's not a simple, single problem. It's not just your heart or not just your lung. It's many shortness of breath episodes are a combination of all of those. So I always liken the best analogy I've ever heard about shortness of breath is just remember shortness of breath is a three-legged stool. Your heart has to work correctly, your lungs have to work correctly, the muscles that drive us to breathe, that help us to breathe, those have to work correctly. And then the seat of the stool is that everything has to work together. So maybe it's not just your heart, just your lung, or just the muscles, but a combination of all of the above. So I'd encourage you to go ahead and keep up with following up with your heart doctor, with your lung doctor, see if they can, again, not narrow it to a single problem, but likely a combination of all those problems.
Tiredness. Well, I don't have the coughing, but I'm always fatigued. So
Yes, ma'am.
I know I have a lot of. I didn't hear that my TV's going in and out. I don't know all the symptoms you said, but I know coughing's not one of them. But I'm always fatigued and tired, and like I said, I'm always short of breath. And like I said, now I'm to the point where I'm winded. I can talk to people, and when I've been in the hospital overnight, I'd go to the bathroom. They said, "Why are you winded? You walked just a couple of feet." I said, "I don't know. I'm trying to get people to help me, and I'm paying all this money to get tests done, and I'm getting no answer. One doctor's blaming it on the lungs are blaming it on the heart doctor, and I'm really getting nowhere. I'm just kind of giving up. So I guess eventually I'll wind up having lung cancer, but I'm trying to prevent it and get answers, and I'm not really." You follow me?
I understand. And again, it sounds like everybody's been looking, and yes, I sense and I share your frustration because of the lack of a diagnosis, of a clear-cut diagnosis in you. As far as lung cancer, it would be unusual that they haven't found anything yet. Surely in your evaluation, it sounds like you've been in hospital, et cetera. They've done x-rays and CTs looking for things in your lungs. Hopefully there are no suspicious problems that would lead anyone to think that you may have lung cancer.
So the symptoms of lung cancer would consist of what? Since you had said it, my TV was going in and out. You said tiredness and coughing and.
It is. Unfortunately, the symptoms are very vague, and you're exactly right. It could be blamed on many different things. So those are an unremitting cough, an unexplained cough, coughing up stuff, especially if you cough up blood. Yes, tiredness. Fatigue is one of them, shortness of breath, unexplained weight loss, or sometimes even weight gain. So there's no one specific symptom that would lead us to think, oh, this is definitely cancer or definitely not cancer. They can be very vague.
So you don't
at
think
times.
the symptoms of shortness of breath is getting worse now that I'm starting to get winded? Because a lot of doctors are saying, "Are you wheezing?" I said, "No, I'm not wheezing, but I am getting winded now." I mean, I can barely talk for a bit, then you have to say, "Hold on, let me stop and catch my breath." Or I'll read a paragraph, and I can only read like 5 words, and then I have to stop, catch my breath, and finish reading the book. I mean, it's I would think that this is cause of maybe.
Well, I'd certainly encourage you to keep following up with your lung doctor, with your heart doctor, because there are many things. It sounds like they've been doing tests on you, breathing tests, etc., to try to figure out. But yes, sometimes it can be difficult to make that diagnosis, to make any diagnosis. Yes.
Right. Well, thanks, Melissa, for your call. And if you have a question for Dr. San Pedro, just give us a call at 318-219-4569. Okay, so we are talking, let's kind of go back to the screening,
Yes.
since this is something that can be effective, I guess, at saving lives and because of that early detection.
It's very effective. If we find, just like with any other cancer, breast cancer, prostate cancer, colon cancer, if we find it early, then we can intervene early. And early detection truly saves lives, extends lives. Early detection increases life expectancy by 4 times in lung cancer.
Wow.
So if we find cancers, say by chest x-rays, or if we find them in late stages, unfortunately there are very limited options. There's still options, but there's nothing like finding it early and truly getting it all out and treating it all out. Yes.
Right. Yeah. And lung cancer, we might have mentioned this earlier, but it's when you have lung cancer, you're at an increased risk for dying from it, right?
Exactly. There are some very aggressive types of lung cancers. So that is one of the main things. Not only finding it, but finding what kind it is. So there are 5 kinds of lung cancers that occur in the lung. Like we mentioned, one is very aggressive, and we try to hurry up and get the diagnosis and the treatment started. There are those that are very indolent. They're very slow growing. Sometimes I'm surprising people saying, yes, you have lung cancer, but this is one we can take our time about. Sometimes the treatment may be worse than the disease, so let's just sit on it. We can follow it over time. The others, unfortunately, we have to keep going. We have to get a stage for the cancer, and then we present those that data to my other colleagues, to my cancer specialist colleagues, who can then sit with the patient and specifically talk them through: is it X-ray? Is it chemotherapy? Is it surgery? Is it a combination of all 3 that we should go ahead and start?
Right. Okay. So when we talked, I think, in maybe the midday news about nodules.
Yes.
So kind of talk about that. What's an incidental nodule, and why do we often hear that term?
So nodules are very common. Nodules, we all hear about spots in the lung. So many of us, actually including me, have spots in our lungs because of all the stuff we breathe in from the air. So many of these nodules are benign.
Okay.
But if you are at risk, if you're a smoker, then we treat those nodules a little bit differently. We watch them very closely. We follow them over time, and we worry about any changes. So because of the increasing number of screening CTs that we can find, I've already mentioned how sensitive the CTs are. We see all sorts of detail. Sometimes we see these spots occurring in people's lungs. Many people, those spots are going to be benign. We breathe in dusts and pollens and all sorts of things in the air. So we don't always have to worry, and those nodules aren't always ominous, but we do have to watch them. So we're sitting down and telling people, and we're going through the risk factors. Have you smoked? How long have you smoked? What kind of work do you do? What are your exposures at work? What are the kinds of things, hobbies, dust that you inhale? And then we try to say, okay, let's watch this every 3 months, every 6 months, every year. We should do another CT and see if there have been any changes. Once those nodules have been stable, no change in size, no change in number, no change in the character of the nodule didn't suddenly form a hole, or it didn't increase in size, but now there's a new head. What a terrible term. But there's a new head on that nodule.
Evolved a little bit.
Exactly. It changed shape. We see, now it becomes an ominous kind of thing, and now we have to be a little more concerned.
That reminds me kind of the process you follow with skin cancer. If it's changed over time, then it might be worrisome. or if it's, asymmetric, or probably not exactly like that, but kind
That's
of
very
similar.
true. No,
Okay.
no, it is. It's the same principle. Change. We want stability. Stability is the goal. So, if the nodule has been stable for 24 to 36 months, 2 years, 3 years, then we can be assured, okay, that's likely benign. While the low dose CT radiation exposure is much, much lower, that's still a substantial amount, right? So, yes, the low dose CT is 15 times less than a conventional CT, but that's still the equivalent of maybe 10 to 20 chest x-rays instead of 70. But so you'd really rather not have it. You have to have it if you do, but if we can prevent you from
Your
having
exposure,
it,
yeah.
then yes, we shouldn't.
Absolutely. Yeah, that's really good advice. So kind of going back to smoking, since we only have a couple of minutes left, correct me if I'm wrong, but it's not necessarily maybe the nicotine that's causing the lung cancer, but it's inhaling the smoke, right?
Correct. It's all the other stuff in the smoke that increases your risk. So it's not just the nicotine, the tars, smoking produces some radiation. So it's the radiation that you inhale into your lung, which actually it's a good time to bring up vaping. So vapes also have a risk for cancers. So we're not just inhaling water vapor. It's not water. It's many other chemicals that are included in that solution that people inhale.
Okay, so maybe it's best to just inhale air, right?
Exactly.
At this point.
Exactly.
But I know that it's a habit and it's kind of hard to kick sometimes. So do you have any words of
Unfortunately,
wisdom for maybe a potential patient or something that you share with your patients?
So we tell people that, look, there are always 5 steps to quitting. And yes, we all recognize how very tough it is to stop. There are stories of people stopping cold turkey, but that's a minority of people. So we always talk about the 5 steps. 1, you got to make up your mind. Nobody else can make you stop. So you, the smoker, will have to make up your mind. 2, you have to set a date. You have to be realistic. I've been smoking for 50 years. I can't expect you to stop smoking within a week. We always tell people, if you've smoked a month for every 10 years that you've smoked. So if you've smoked 50 years, it'll take you 5-6 months to stop. Don't forget about the other associated habits that are with that. You're used to having something in your mouth. So people come up to me and says, I stopped smoking, but I gained 20 pounds. Well, that's right, because you've substituted fried chicken or a pizza for that oral fixation that you have with your mouth.
Right.
People always say, I become nervous. Yes, because you've always had something in your fingers. So have something in your fingers. Have something in your mouth. Sugar-free mint, sugar-free gum.
Right. We've got about a minute left, so if you can fit those in.
Absolutely. And then we talk about the last thing, behavior modification. People always say, I smoke after I eat. I sit down, I have my cup of coffee and my cigarette. Great. But you got to change that behavior. My mother took the chairs out of the dining room, so my dad couldn't sit down and have his cup of coffee. So that broke his habit.
Okay,
so the last thing are the nicotine. So people always concentrate on that, but that's the last thing.
Okay, very interesting. Good stuff, too. Thank you, Dr. Jerry San Pedro. And if you missed this conversation and you wanted to rewatch it, or you wanted to, you're just tuning in and you wanted to watch it, ktbs.com/podcast is where you can find it. And again, thanks, Doctor, for coming in.
Thank you very much for having me.
Of course.